But we're forgetting that we have undersold the mental health benefits of moving every day. Now, remember, I consider exercise movement time with compliance, whatever you want. That could be vacuuming 30 minutes a day, being in your garden, doing Tai Chi, whatever gives you joy. But what we've learned is that it turns on all these kind of switches in the parts of the brain that put us in a better mood. And also, I always give it an acronym, which we don't have time for. We now know it reduces stress, anxiety, depression. We also know it reduces catastrophizing, which is tough in cancer, where you're thinking pervasive negative thoughts, right? And I'll leave you with this as we go back, because this is really about you, the Q&A right now, but because we'll talk about, I talked about in the introduction. I will leave you with one word in exercise, and that's called the hippocampus. The hippocampus is the memory area on the temporal lobe on each side. And researchers have figured out that it's the one part of the brain that's exquisitely, sensitive to movement and exercise daily. You bring blood flow in there and it helps keep it the same size. If you don't move, it starts to atrophy. So if you are a neurologist, you're now being a trained neurologist, you're learning in your clinical guidelines in the past 2 years that one of the ways to stop mild cognitive impairment from moving over into dementia is actually exercise. So it is a mental health pill that if it was given the credit it deserves, it would win a Nobel Prize tomorrow, because people are probably asleep in Europe. So they would have to give it tomorrow. That's the only, otherwise they give it today. So stress, anxiety, depression reduces catastrophizing, reduces suicidal ideation, which people don't like to talk about, but that's true. And it feeds your hippocampus, which is your memory center. And I've told you this, and I believe in this firmly, that if someone's going to go on androgen deprivation therapy and they're going to go see Mark Scholz, or they're going to go on any of the pills that mess with your hormones, if you're not agreeing to do some movement time every single day, you're fired. There's just no way, because you're starting so far behind the starting line with that patient. I don't think it's fair to the patient or to the physician. This is the last thing I'll leave you with, which we've never discussed before in exercise, which is amazing. And this was discovered, in my opinion, if you look at the data, by the Canadians. They looked at the men that you treat in the age group that you treat, and the women also. And what they decided to do with this group is that they were moving regularly every day. They decided to say, listen, for a couple of weeks, we want you to do nothing, just take it easy, just for a couple of weeks, compared to younger people in their 20s and 30s. And when they stopped moving for a couple of weeks, they said, okay, now go back to doing what you're doing. And as they started to look on month after month after month, they never got back to baseline. What that means is, as you get older, you do not have the luxury of turning it off for a short period of time. It takes your body so much more time to get back to where you were in shape as you get older compared to when you were 21, including even insulin resistance. So the Canadians have discovered the worst thing you can tell a patient, in my opinion, is just take it easy for a week or two. You can get back into shape, no problem. You can feel that. That's not what's happening. And I believe that's not what's happening mentally. So if you're taking 5-6 days off and you're not going for a walk, you're putting yourself so far behind the 8 ball that trying to catch up could take you 6 months, a year, maybe never. Yep. So if you're going to get androgen deprivation therapy and you think that 2 months after your injection, or when you take the new pill now, you can just pick it up then, you have already so far behind that you're going to struggle the rest of the way. So I hope that helps. I'm glad you asked me.
Mark, that is pure gold. And we could probably do a whole conference just on exercise, and we'd be delivering the same value. And everyone I know is experiencing the value of these amazing people like Dr. Agano and Dr. Hope. It's just like, wow, what individuals. They're just dedicated themselves to this expertise. They're so articulate. They're so passionate. But if we just did a conference talking about the value of exercise, we would probably do as much or more good than what modern medicine is providing. And I don't denigrate modern medicine. I'm a deliverer of that. So thank you for that. And I know that you said a lot in a very short time, but it's you and I both know how important this is. And I love that idea of, if you back off, you can't just pull it back to where you were. You want to have sustained exercise. And even if it's a daunting prospect, cut back and just do something every day. Get in a rhythm. Most of you, I hope, are brushing your teeth and taking a bath periodically and exercise. You're sleeping. Exercise should be part of the no consideration for not exercising.
You are a machine, and when you're a machine that's of the age, well, like a car, when you're of the age of me or you, it's no longer called a machine. It's called an antique. We're old. So if you have a 50, 60, 70-year-old car, they don't go, oh, that's a beautiful car. They go, that's an old damn car. And so you don't say, hey, in order to keep that car running, just, press your foot as far as you can on the gas pedal all the time, or just never use it. The idea is you're always using it in moderation and you're always maintaining it. How many patients do you see that say, it just took me a lot longer to recover from that injury. It just took me a lot longer to recover from this. That's because we're older machines. Yeah. And we have to be good to our machines, which means you can't take your machine, put it in the garage for 4 months and go, have a nice day. I'm going to pull you back out sometime in August. Yeah. You got to keep the wheels moving, lubricated. You got to keep the engine light on every once in a while.
Let me make one last comment on that, because there's a lot of medical experts that don't understand what you and I are saying. So you'll have patients that'll go through an operation or something like that, a hernia operation. And the doctor will say, I don't want you to exercise for 6 weeks because he doesn't want his little hernia to pop, which is, of course, important. But this whole idea, and these patients take it to heart. They do nothing for 6 weeks because the doctor told them. Yeah. And it's just like, there's a lot bigger picture than your little scar here. There's your whole life.
There's studies going on, and I firmly believe this, looking at concussions and players that suffer concussions, and that's a worrisome thing. But a couple of groups that will remain nameless right now, it's very preliminary. They looked at people that were concussed, and they had them up and around walking again very soon, as opposed to sitting in the bed. And they found out that the damages of the concussion seemed to be a lot less when they're not saying throw them back in the game. They're just saying, do not reduce your physical activity time. Lower back pain, chronic lower back pain, which costs billions of dollars. In the old days, hey, just sit around, don't do anything, your back hurts. No, the recommendation is now get back up, start moving. You'll recover as quickly, if not faster, because the machinery wants to move to recover. Yep. And so I will leave you with this story. I kid you not. Yesterday, a patient who's a patient of a doctor friend of mine in California called me from the hospital and said, I was just treated for prostate cancer. What should I ask my doctor? And I said, this was the day after surgery. I'm sorry, I'm using the word surgery. I said, the only question I think you should ask first and foremost, and then we'll talk about the other ones. He goes, what? How much maximum exercise can I get starting today? He said, well, I can get up and walk. I said, no, that's not the question. What's the maximum amount of walking time you can do the day after your treatment? The maximum, yeah. Don't say minimum. We're not thinking minimum. And I think it's going to improve your recovery time if you think maximum. And he got involved in that discussion and was very happy. Thank you for that.
Thank you,
therapy. It was awesome.